Hello, everyone. Welcome. This is Michaela Conley, HP CareerNet, and as you probably can tell by now, we are trying a different platform, and we'll know by, 60 minutes from now if we love it, hate it, or, want to go home and sit in the corner. So today we have, Tess Benham and Suja, help me.
Shanmugavelu.
Easy for you to say. From the National Safety Council. Thank you for that help because, boy, that's a lot of letters. And
no problem.
I'm just not good. Anyway, so they're going to talk about National Safety Council and sort of your take on worksite health promotion and beyond. So are you ready to get going?
Yes, we are. Thank you for the opportunity to speak to those companies and people interested in health promotion. We really appreciate this opportunity. For some of you, you may have heard of the National Safety Council. We've been a not-for-profit, and we were founded in 1913, and we have that grassroots foundation of many not-for-profits. We were founded by a group of safety-conscious companies who were concerned as industrialization was taking place in more factories and assembly lines were being developed. They were very concerned about the rising increase of very severe disabling injuries and fatalities that were occurring in the workplace. And so they started meeting in 1913 and founded our organization. And since then, we've been focused on workplace safety. Many of you may know us from workplace safety. We also, as we began tracking injuries and injury trends, we realized that a number of people who work also got hurt on our roadways. And so we have a strong role in transportation safety as well. But we've always had also an interest in safety in home and community settings. Our mission is to save lives by preventing injuries and death at work, in homes and communities, and on the road through leadership, research, education, and advocacy. And we partner with a variety of organizations to improve safety in the United States, and actually we also operate globally. We are a leader in workplace first aid and defensive driving training. We have a number of strategic initiatives that we're focusing on. One is the journey to safety excellence, what workplaces can do to build a process of continuing improvement to keep employees safe while working. We also are the #1 advocate on reducing cell phone use while driving. It is the #1 driver distraction. And then teen driving, the #1 cause of deaths. We have a number of great initiatives going in terms of building state coalitions to create a culture of safe teen driving. And safety off the job, where 9 out of 10 deaths occur. Today you are much safer sitting at your desk at work or working in a factory than you are walking around our communities. We have 54,000 members, and we have chapters throughout the U.S., and as I said, we also have a global network. You may know us through our advocacy efforts, or you may have attended our Congress and Expo, the largest gathering of safety professionals. We also have a number of publications that you may have had an opportunity to check out: our Journal of Safety Research, our monthly magazine, Safety and Health, and then we also have Safe Communities America. And we have, Michaela, we have a number of safe communities that are up and rising in the Kentucky area. And so if you're not living in a safe community, I urge you to talk to your community leaders about receiving the Safe Community designation. I mentioned a little bit about our journey to safety excellence, and this is a safety philosophy of continuing improvement, of engaging leadership and employees in safety, about making a commitment towards risk reduction and driving injuries to below zero, about measuring your performance on safety, and managing and advancing your safety management system. And we believe that not only do you need to do this in the workplace to keep and protect your employees so that your employees, when they arrive at work, go home in the same condition that they arrived, but we also believe that this journey to safety excellence should extend beyond the workplace, and that the workplace should be a place where people's health does not get worse, where there are things in place in the work site that promote healthy behaviors and help employees make the right choices for their health as well as their safety, but that when they're not at work, that they're carrying some of our same safety messages that we apply at work home, so that they're much safer, so that they become more safer and they take safety actions off the job as well as on the job. That safety isn't something that only happens from 9 to 5, that safety is something you do 24 hours a day, 7 days a week. So I wanted to start off a little bit with what is the national situation for unintentional injuries? And this data may be surprising for some of those who are on the phone today. I talked a little bit about workplace safety, and I mentioned that today you are safer at work than you are in your home or in the community. And actually since 1992, and this is the year where they started linking the fatality, workplace occupational fatalities to the census data, and so that's why we're starting with 1992 for these next couple of charts. The workplace death rate has gone down 33%. We have made remarkable progress in keeping our work sites safer for employees. We have made similar progress on making our highways safer. Our roads and our vehicles are much safer today than they have ever been in the past 20 years. We've made great improvements in terms of the technology in cars, anti-lock brakes, better seatbelt systems. We've increased seatbelt use. We've made great strides in making our roads designed to be safer. And as a result of that, the highway death rate is down 34%. Unfortunately, the situation is not the same for home and community. In fact, the home and community death rate is up 74% in that past 20 years. If we had just held steady and this trend was not rising so sharply, we would be seeing our overall unintentional injury rate going down. But that's not happening because of the steep increase in unintentional injuries that occur in home and community settings. There are a number of things driving these numbers. One is still motor vehicles is one of the leading causes of unintentional death off the job to workers. We've also seen a sharp increase in the number of deaths to adults from unintentional poisoning, and this is driven largely by the use of opioid, analgesics, or very strong painkillers. And so those are the two things. There's also been an increase in deaths due to falls. A lot of those are among older adults that are starting to drive these home and community rates up. So the total unintentional injury rate is up 23%. And so while we're making great progress in the workplace and we're making great progress on the highways, your employees today are more likely to be injured or killed coming to work or working in their homes, doing a leisure activity. And so that's what I wanted to talk a little bit today about what employers can do to help reverse some of these trends. And as I mentioned, unintentional injuries is the #1 cause of death for people ages 1 to 42. It's the 5 cause of death for all ages, and if you add in suicide and intentional violence, we jump up to the number 4 cause of death overall. And here's the leading causes of death: heart disease, cancer, stroke, respiratory diseases. As I said, if we added in suicide and violence, homicide, we would jump up above respiratory disease. 1 in 9 people sought medical consultation for an injury in 2008. That's 38.9 hospital or doctor visits that are hitting people's health insurance and medical claims data. The cost of injuries is $5,900 per household, $2,300 per person, and these are the direct costs. There are also indirect costs to employers of lost productivity and lost work time. So let me kind of get us on the same page with some terms. What does off the job mean? That means that these are injuries or incidents that happen when people are not working, when they're not officially on the clock for their employer. It includes people who are full or part-time employees, but they're not at work. It excludes children, people who, homemakers, people who are retired or unemployed, or people who are just not in the workforce. So when I'm talking about off-the-job injuries and deaths, I'm talking specifically about those people who are directly in the workforce. So when we look at off the job compared to on the job, we have the same number of people at risk, 141 million workers in the U.S. And when we look at the comparison, we have 3,500 on-the-job deaths that are occurring annually in the U.S. But off the job, that equates to 55,000 off-the-job deaths. And the same is true for medically consulted injuries. Medically consulted injuries are 3 times as high as workplace injuries. And here you can see the comparison. You're 16 to 1 more likely to have an off-the-job death than an on-the-job death. And as I said, you're 3 to 1 more likely to be injured while not at work than while at work. Time lost from work, it's 6 days to every 1 day lost for off-the-job injuries. And in future years, you can see how this will continue to grow to 545 compared to the current number of lost work days of 255. And this is particularly true as we consider the demographics that as a country we're aging. And so one of the things that when we talk to employers about is the increase in older Americans who are still in the workforce. And one thing we know about that is the incidence of chronic disease is higher among that older employees, but also their injury rates are higher as well. So that's something to think about as we age. These numbers may continue to go up.
Yeah, I was going to say, certainly in the news this week, even the age at which people are going to be able to collect Social Security, so they're going to have to stay at work.
Mm-hmm. Yeah, and particularly now that we're in a down economy, more people are also having to stay in the workforce.
Yeah, for sure.
Now, when we talk about chronic disease versus injury, one of the things to think about is that the average remaining lifetime for people with chronic diseases is you can live a long time with a medically supervised chronic illness. The same is not true for injury. If you have a car accident and someone dies, there's a lot of remaining lifetime for that person. So what does this mean is that on average, people are 20 to 25 years younger than the people who die from other leading causes of death. They're still in the workforce, they're still raising families, and they would have lived on average another 27, almost 30 years past the time of the injury-related death. So I want to talk a little bit about how this impacts the work site directly. So of all unintentional accidental deaths, 49% are occurring to people who are still in the workforce. 63% are actually workers and their family members. And so so when we talk about unintentional injuries, it does have an impact on the workplace. When you think about that, 2/3 of all of the people who have an unintentional injury-related death are working, or their family member of someone who's working. So why focus on the workplace? Workplace programs have direct access to 141 million workers. Through employers, we can reach beyond the workplace to address family, safety, and health issues. And the things that people learn at work, the policies and the practices that workplaces put into effect, influence about 65% of all adults. And so employers have an important role in getting this message out of both improving health, improving well-being, but also in terms of promoting safety, that employers have a valuable role that they can play to promote safety when people are not at work. So let me go back.
You want to do that poll?
Yeah, let's go ahead and do that poll right now.
Okay, great. Do the first one here. You know
I
what?
thought it would be helpful to maybe take a check-in at this point to see how many people on the call today actually are doing health promotion at work with their employees.
Okay, can you see that?
Yeah, I can see it. So
Okay,
if people could just click yes or no if your company currently offers a program that promotes employee health and well-being. And we'll give people a few moments to select an answer.
About 58%, 67% responding.
Oh, that's great.
All right, I think they stopped coming in.
Okay. So let's see the results. So about 67% of the people on the phone today have an organization that offers programs to promote employee health and well-being. And this is a little bit lower than what some of the research is showing. Research is showing about 80% of the companies with 50 employees or more offer worksite health promotion programs. And this is also true of our NSC members. What we don't know as much information about is how much safety promotion is being done in conjunction with those health promotion activities. And so I'd like to do a quick second poll to check in and find the temperature of how many companies who are doing the health promotion are also focusing on off-the-job safety. So if you could do the second poll, Kelly.
Okay, can you see that?
Not yet. Yes, now I do.
Okay.
I had to switch tabs.
It does seem like it should be sort of a natural outgrowth to a workplace health promotion wellness program.
Yeah, and that's where kind of where we're kind of looking at is how can we encourage more people or more companies to also focus on safety as they talk about preventing chronic diseases as well. And so I have some resources to share with our audience.
Okay, the answers have stopped coming in, so I'm going to share the results.
Mm-hmm. Yeah, and seeing what we've found, so we have about 17% who in their health and wellness programs also talk about safe driving, kitchen safety, and other home safety topics. And so this, again, it's a little bit lower. We find about anywhere from 35 to 52% of our NSC members also include off-the-job injury prevention in their company health promotion activities. And the range of activities kind of ranges from general awareness to fully integrated employee safety, health, and wellness management systems. And one of the things we're seeing a trend in is more companies breaking apart those silos and actually having the safety professionals, the people in their company who are dedicated to occupational safety, actually part of cross-functional teams working with their wellness coordinators, their occupational health physicians and nurses, working with their HR in terms of what are the benefits and what are the health and wellness programs offered, to create some synergy so that they're addressing both injury as well as disease prevention. So I'm sure many of your audiences know that the evidence shows that worksite health and safety promotion and wellness programs are effective in creating more increasing productivity and lowering employee absenteeism, and that employers with healthier employees spend less on direct medical costs, workers' compensation, disability, the cost for training or recruiting new employees. There's also a positive cost-benefit ratio that for every dollar spent on health promotion and wellness programs, it generates a positive cost savings. And the caution is that some interventions may take longer to begin to show a payback. And so some of the more intensive interventions in terms of obesity prevention or the reduction of chronic diseases may take a few years before you start seeing a true decrease in or an increase in health. I wanted to highlight one quick study. At IBM, they had 11,000 employees complete a voluntary web-based program, and they earned a $150 rebate. During the program, participants chose family goals from a list of options. And some of the results were 17% increased their physical activity, 11% increased activities around healthy eating, reducing television viewing. And so what this study shows is that employers can improve short-term behaviors not only in their workers, but also in their workers' families. And so that's important thing to realize is that employer-based programs can have an impact beyond the workplace. And so now I want to talk a little bit about what NSC is doing and share with you some of the resources that we've developed to help employers develop programs that address employee safety beyond the workplace. One, we consider this part of our journey to safety excellence, that occupational safety should not be limited, and that employers should be looking at safety beyond the workplace, because that is where the majority of injuries are occurring. That is where companies are at the greatest risk for lost productivity from injury and injury-related death. And so we developed the Family Safety and Health Employer Resource. I'm going to spend the last few minutes of our webinar today walking you through the resource, giving you a tour of the website that we've developed. In order to register, you would just go to this link, beyondworkplace.nsc.org. It's a resource. All employers can use it. It does require some information about your organization and about, and we ask that you complete a baseline survey because we developed this in partnership with CDC, and we are doing an evaluation of the effectiveness of the resource, and so we're trying to encourage people to take that baseline so that we can really measure if these type of interventions are effective. We also have a webinar series, and we invite you to check out the upcoming webinars to see if there's a topic that would help your company with their programs. And then we have another resource, Our Driving Concern. It's an employer traffic safety program that provides tools and resources for employers to address traffic safety among their employees. And that website is loaded in, and so I'm just going to give you a peek at that. Here's our website on employer traffic safety. We cover 4 topics: distracted, impaired, aggressive driving, and passenger restraint. We have a ton of resources and links. We have brochures for employers on how crashes can wreck your business, on aggressive and impaired driving, and all of them offer tips and resources on how employers can implement a traffic safety program for their employees. Now I'm going to switch back to the slides, and I'm going to share my desktop so that I can take you on a walkthrough with the Family Safety and Health Employer resource. Because it has a registration process, we can't upload it to do the web sync. So in just a second, I've shared the resource. Once you've registered for the resource and you've accepted the terms and conditions, this is the first screen that you would see. This is our welcome page. Currently, we have 4 modules in the resource. It was developed in partnership with the Centers for Disease Control and Prevention. We've relied extensively on their subject matter experts to develop the content and the direction for the resource. We start off with, how do you build a family safety and health program? So we provide resources on making the business case, protective actions that you can take, essential elements of a family safety and health program, steps for continuous improvement. We provide a number of tools on how to do assessments and performance measures. So click on this page and show you real quick. So here we talk about creating a baseline and establishing employer metrics. We link you to injury data, benchmarking data, state and county health and injury data, national data. Whenever possible, we've tried to create some interactive features that people can use within the resource. So here's an example of one. This is a CDC widget that will open the Whiskers Injury Reporting Statistical Database. Here, a company could go and run reports, I think almost at the state level or possibly even lower, to look at injury data that they could maybe benchmark their program with. A topic-based thing would be like tobacco cessation, and again, in each topic we provide an overview, we provide information on some of the key factors that should be considered for that health topic, secondhand smoke, the importance of a tobacco-free policy, information about treatment and treatment options, the health benefits of cessation. We include facts that companies could share with their employees in our Did You Know section. And again, we've included widgets that they can add to their intranet for their company. We are in the process of, Monday we'll be live with physical activity. We have healthy eating following shortly behind on the resource. We've taken an approach of looking at primary prevention. So looking at what are the things that employers need to do that they can implement before an employee has an injury or before or to promote the start of a chronic disease. And so we kind of focused on those strong evidence evidence-based solutions. And so we talk about driving safety and preventing unintentional overdoses. Those are the two leading causes of home and community deaths. And so we provide information about those issues and resources on how employers can address those issues with their employees. In terms of preventing chronic health conditions, we focused on tobacco cessation, vaccine-preventable diseases, physical activity, and healthy eating. Many people don't know that with just a 10% reduction in weight, that many people can move from being pre-diabetic to an area where they're less, where they wouldn't need to go on medication or other drugs and treatments. So just small changes, something as small as losing 20% of your body weight can have enormous health benefits and health cost savings. Those are kind of on the left-hand side are the topics. On the right side, we have these quick links. And so I want to sort of explore these quick links. This is where you can find links to the latest research. So if you're a company that needs to present the latest research to your employer and in terms of why our company should invest in a family safety and health program, or why we should be adding injury to address this, you can go to the latest research and you can click on a topic, and on that topic it would give you all of the latest research for that issue. So one of the nice things about being a member of the National Council, and if you're not a member, I encourage you to become a member, but we have an incredible library. We have one of the largest research libraries in the world on workplace safety and health topics. And so you could do a targeted search with our library and get a printout of all the articles related to that topic. So here is the second-year results of an obesity prevention program at Dow Chemical. And if you look here, you'll see that when you see the little green arrow, these are available free from our library if you're a member. But if not, we still have the links to where you can access that research report. We have also combined all of the resources for these topics. And so if you look at tobacco cessation, what you'll find on that page is a list of resources, fact sheets, tools, reports, again, that you can use and begin implementing with your company. Program elements. One of the things many companies don't realize is the strong correlation between your employee benefits and your company policies and promoting and developing effective safety and health programs. And so under program elements, what you'll find, and I'm just clicking on these randomly, each one has a little bit of different information, but all of them include the same program elements. So in terms of program elements, we talk about workplace policy, benefit design, health and safety education, behavioral and cultural issues, worksite support. And worksite support is what are those modifications you can make in the physical and social work environment that can support your employees' decisions to be healthier or safer, healthier at work and safer off the job, as well as healthier off the job. And so for these, we have resources. So we have sample policy statements. We have a link to our cell phone policy kit for employers on implementing a cell phone ban in your company, which I encourage you to consider. We also link to the National Business Group on Health Purchaser's Guide. If you're not familiar with the Purchaser's Guide, it's this wonderful research where if you're in charge of purchasing medical and health benefit programs for your company, they've created purchasing language that you can put into your RFP for your health benefits plan that is tied to the most clinically effective information. So if the clinical recommendations are that adults be immunized or influenza, they have information that you can put right into your health benefit plan so that your health benefits are linked to the most clinically effective screening and testing options. Talk about health and safety. So here on benefits design, what you'll see is a PDF that talks about things that you can include in your benefit. And so having an employee assistance program is something if you're looking at reducing driving fatalities and driving injuries, one of the things that you can do with your benefits plan is making sure that you have an employee assistance program that provides a way for employees or family members who may need assistance with drinking or substance use to have access to treatment. The same is true in your medical plans of making sure that they include screening, brief intervention, and referral to treatment so that if this is an issue for someone in your workforce, that they have access to the treatment needed to address that issue. So there are things like that that can help. Same with, in terms of worksite support, having a drug-free workplace policy helps identify those people who may be at risk for impaired driving. And then we always try and have, including community linkages, ways that employers can leverage community resources if they don't have the resources to have an EAP or hire a lifestyle coach. Under tobacco cessation, you can still take advantage of telephone hotlines that are operated by your state that help people and coach them through tobacco cessation. The last quick link is assessment tools. And we've tried to provide linkages to tools that may be available through other sources that can help you assess the effectiveness of your program. And so here we have some sample opinion surveys that were developed by the North Carolina Department of Health and Human Services. There are employee needs and interest surveys that can help you address tobacco cessation, as well as an organizational readiness checklist and a sample program evaluation tool so that companies can begin to start creating some performance metrics so that as they implement these programs, they can report back to their management on some of their successes in terms of what they've done. So I'm going to go back to our slide presentation. Michaela, I may need some help. Oh, there I am. Okay, so I'm back to the slide presentation. Thank you. And basically, I've talked about these things. I'm not sure if anyone has any questions or comments. I really encourage you to register for the resource, to pass this along to your peers who are interested in family safety and health, and you know, do think about how you can make safety a part of your health and wellness promotion program. I think not focusing on safety, you're missing some of those key drivers that create lost work time and lowered productivity for your company. Here's my contact information. So Kelly, Michaela, I'll turn it over to you for questions.
Oh,
okay,
great.
So if you have, oh, you're back. Go ahead, Michaela.
Oh, no, I was going to say, yeah, if you have questions, type them into the box, and Kelly or I can read them. Actually, Kelly, I think you have to read them. That was really interesting. I had no idea you have so many free resources available, even for people who are not members, who probably should be, but they're just not yet.
Yeah.
So do most work sites, I mean, when I think of National Safety Council, I think of like an industrial type setting. Do most work sites beyond, sort of that industrial kind of environment? Are they members? How do you reach those people?
Yeah, we have
people, I guess.
Yeah, we have people who are both, who have both types of work sites, and in fact, it presents interesting challenges as by organization size, or actually by the type of the organization. Sometimes people find it much easier in settings that are largely office-based to do some of the health promotion things, because you have a little bit more access to the internet in terms of sharing resources with employees and email. When you start talking about companies that have a manufacturing site, not every person in a manufacturing place may have access to email, and so what we find is that how programs are delivered may change between the types of settings, but that both settings actually generate positive cost savings by focusing on both health promotion and safety promotion, both on and off the job. So I think the big challenges come in terms of how do you roll out your programs and what tools you use to take your message to your employees.
Yeah, I think that's a really good point, which makes me think about, I've seen recently that companies are talking about, well, a lot of people are talking about rolling out programs via mobile phone technology.
Mm-hmm.
There's an app for that.
Yeah.
Have you guys thought about that? Are you moving in that direction?
Yeah, we have thought about that. One of the challenges for us is that, we are a not-for-profit, and so the development costs and the IT capabilities of creating an app is something we're exploring. But again, we have to figure out our resources in terms of can we afford that. But I do agree with you. I think the direction is moving towards mobile technology and moving towards more direct interaction. I think people today want to be able to interact information in a mode or a style that's most comfortable for them. And so for some people it may be a print piece. For others it may be a phone app or a link to an internet site. They want more targeted information and information that's more individually focused on where they're at. I don't know if you're finding some of the same thing as well.
Yeah, I think that's really true. I've been thinking about, as the people who've grown up with the internet, who I saw a story the other day talking about how, an actual phone call may become obsolete because, so many people don't even use their mobile phones for calling anymore. It's just all, it's all communication in other ways.
Yeah.
Kelly, do you have questions?
I still don't have any questions, so don't be shy. It's right on the lower left of your screen there.
Yeah, it could be a fear of new technology.
Could be.
Yeah. So.
Well, come on, you guys.
Yeah, and I should point out, I've also included some slides in the appendix for those people who download the presentation slides. There's some additional resources in the appendix, some information I didn't include on home and community injury trends and deaths, as well as some information on another worksite promotion program, and a slide on some of the organizational best practices.
Oh, super. And do you work primarily, I suppose you work probably pretty closely with the business group on health?
Yeah, we do work with the Business Group on Health and also the National Business Coalitions on Health. And for those of you who are not familiar with those two organizations, the National Business Group on Health does a lot of work with large companies that that purchase healthcare benefits and look at and develop programs that address some of the major issues that they're focusing on. And so they have some work groups that are working on obesity in the workplace and other issues. The National Business Coalition on Health are actually local business coalitions that coalitions of employers who have grouped together to improve the quality of their health benefit programs, and they have some cool tools on how to evaluate the effectiveness of your health benefit programs. In fact, I think we have Dennis White, who's going to be coming up on one of our future webinar series, along with Jonathan Thomas, talking about how do you evaluate and determine the effectiveness and impact of your family safety and health programs. And then, the National Safety Council, while we're a membership organization, we do have a lot of additional resources that are available for companies. So I do encourage people to check out our membership options.
Yeah, that's what I was going to ask you, is about the membership options. Is it typically a organizational membership, or do individuals join?
It's an organizational membership, and so I think for many companies it's as low as $300 some dollars a year to become an organizational member, and you get access to a lot of employee benefits in terms of free webinars, downloadable resources, and other information.
Yeah, I think you mentioned briefly that you do quite an ambitious webinar series.
Yeah. So we have our Family Safety and Health webinar series. We also have our member-only Members Helping Members webinars, and then our magazine is a benefit as well for members, and it's a gorgeous. We have some gorgeous magazines and publications that are available to people.
Actual print magazines?
Yeah.
Wow.
Print and electronic, but primarily the magazines are primarily print, and then we have some electronic newsletters and member news alerts.
You've got it in every which way anybody might want it.
Yep.
Excellent.
So, still any questions?
No, everyone is still so quiet.
Okay.
But during this time, for a quick commercial message, if you're listening today for ACSM or CHES credits, continuing education, if you look down in the chat box, you'll see that the discount code is there and the link to purchase the credits for after the webinar. That's also the area where you would enter a question if you'd like.
Hint, hint, nudge, nudge. Well, you know they're going to come up with them. It's just not they're just not finished digesting all that good information. So your email address is there. That's great, and they can follow up with you. And certainly, if they send any questions our way, we will make sure that you get them. And I really appreciate you being here today. I think in my small world, I think National Safety Council, I think of driver safety and industrial stuff, and you guys have so much more. You have so much more valuable, so many more valuable resources than just that sort of narrow view of mine. So I promise I'll never have that narrow view again.
Thank you. And please encourage people to check out the Family Safety and Health Employer resource. It's a work in progress. We're adding new modules every month and new information to our existing modules, and we really do encourage people to check it out because it provides some tools and resources to begin creating a comprehensive, integrated family safety and health wellness program.
Well, I think it's
so I want to
Oh,
yeah, I want to thank all your viewers and listeners today for attending.
Well, thank you for being here, and thank you for sharing all those wonderful resources, and we will talk again soon. Have a great weekend.
You too. Thank you.
Thanks. Bye.
Hello? Oh. Okay, wrong headphones.